My name is Joshua, and this is my mom. Today I came to the hospital to have surgery. We had to go to the third floor to check in. We followed the train and the signs to outpatient services registration. When we got there, my mom had to fill out paperwork and talk with the nice ladies. I brought some games to play while I waited. After a while, a nurse came out and called my name.
Hi, Joshua. I'm Zach.
They needed to see how tall I was and how much I weighed, so I stood on a scale. It was time for me to go back to the exam room and get ready for surgery. He also checked my temperature, listened to my heart with a stethoscope, and checked my blood pressure with a cuff that hugged my arm. He placed a soft clip with a red light on my finger called a pulse ox. I got a red wristband that told everyone that I was allergic to a medicine called penicillin. And the nurse gave me and my mom matching ID wristbands to let everyone know who we are. Then they gave me some hospital pajamas to change into. Next we met with some doctors. They wore special clothes called scrubs. One of the doctors I met was the anesthesiologist. This was the doctor who gave me medicine that helped me sleep during my surgery. The doctor told me that I would get my medicine through a mask and that I could pick a flavor to put in it. I picked out strawberry. I also met a lady called a child life specialist. She showed me pictures of the room where my surgery would happen and what the mask would look like. When it was time for my surgery, a nurse came to my room, checked my wristband, and asked me for my name and birthday. She also asked me when I had eaten last. It's safest for your body when you don't have anything to eat or drink before you come to the hospital for surgery. Then we left for the room where I was going to have surgery. On the way to the surgery room, we used to go straight past the holding room to the surgery room. When the nurse and I walked into the surgery room, I saw the bed, some big lights, and a larger scene that the anesthesiologist used to get my sleepy air mask ready. The nurse helped me onto the bed and gave me a blanket to keep me warm. While I was sitting on the bed, they put the pulse ox on my finger and some stickers on my chest and stomach to monitor my heart. They felt cold and gooey. The anesthesiologist helped me hold the mask over my nose and mouth. It smelled like strawberries. They told me to take some deep breaths, and I started to feel sleepy. After a few seconds, I fell asleep. This is the room where I woke up. It was kind of noisy there. I heard people talking and machines beeping. A nurse checked on me to make sure that I felt okay. If I wasn't feeling very well, the nurse could give me medicine through my IV. The nurse told me that my IV was a small bending tube in my vein, that it's covered up with tape. I got it while I was asleep. My mom was able to be with me the rest of the time I was in the hospital. I was still sleepy when I went to my next room, which was also called the recovery room. They gave me a popsicle and let me watch TV until the doctor said I could go home. My surgery was called outpatient surgery, which means that I got to go home. Sometimes after surgery, you may need to stay in the hospital. Thanks for learning about my surgery.